Welcome to Time Warner Cable DMG TV2's Medical Minutes. I'm Jennifer Clark. Coming up on today's show, we're going to talk with Vicki Iono. She is the Health Commissioner for the City of New Philadelphia's Health Department. They have free HIV testing. We'll have an update. Also, Norm Mast. He is the Executive Director and President of Community Hospice, and he'll tell us all about the Hospice House and all the new and exciting things going on with his group. Then we'll wrap up with Dr. Bill Swoger from Union Internal Medicine Specialties. He talks about influenza and the flu. There is a difference. Coming up on Medical Minutes.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, Newcomerstown, and Millersburg. Let's get started building our relationship.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to Medical Minutes here on Time Warner Cable's DMG TV2. I'm Jennifer Clark, and this segment we have Vicki Iono. She is the Health Commissioner for the New Philadelphia City Health Department. Welcome to the show.
Thank you for having me.
And the reason we have you on is because New Philadelphia's Health Department offers free HIV testing.
That's correct.
What are you testing for?
We're doing a rapid test. And the test actually is very sophisticated, even though it looks very simple, and it looks for the DNA from the virus that may be in the blood.
And it's just a finger stick?
It's just a finger stick, like you'd get a blood sugar.
And when do you get results?
It takes 20 minutes. We actually set a little timer, and we talk with the client while they're there and offer them some suggestions on how not to be excited about retesting if they do some right things or adjust their living or behaviors, or and make them understand what HIV is.
And what is HIV? I mean, that's not AIDS, but it leads to it?
No, HIV is a virus that can lead to AIDS. It attacks the immune system, and after the immune system becomes very, very low, it becomes an AIDS situation.
And you can die from AIDS still?
Absolutely. We have had people pass this year in this county.
And how many people come in for this testing? Is it daily?
Actually, it varies. Sometimes we have no one. Other times we did 12 the other day. So it just matters. It just matters on the day.
And do they all have a different story of why they're coming in? Are they drug abusers? Do they have multiple partners? I mean, why are they coming in?
Well, some people just want to know their status. We've had people ranging from 14 to 93. So we have people come in for all reasons. And you know, we've all lived life and we've all had exposures to things, and it's good that people want to know their status.
And when they find out if they're positive, what do you do for them?
Okay.
You don't just send them out the door and say good luck to you.
No, absolutely not. If they are positive, we sit with them. We do a confirmatory test while they're still there, and that involves swabbing the inside of their cheeks with a swab, and that actually gets put into a test tube and off to Ohio Department of Health laboratory to confirm our findings. The tests are very, very accurate. The rapid tests that we use, 99.9% accurate, but we do want to confirm it. We don't want to give anyone a false positive and have them leave and think they are when they weren't. So we want to confirm that, and that takes a week. We'll have them back in our office, and we follow up with them and give them the confirmatory test, and then we refer them off to people who can help them with get antivirals, can do further testing on them, and for free. We have a lot of connections to free medications and free testing.
And you don't have to be from New Philadelphia to walk into the City Health Department and get a free
Absolutely
HIV
not.
test.
Absolutely not. You can be from anywhere in Ohio. You come in and see us, and we'll give you that test.
And the testing supplies and the expertise, and that can be expensive. How do you pay for that?
Well, we received a grant from the Canton City Health Department through Ohio Department of Health, which probably originated from the Center for Disease Control. They provide us with the tests, they provide us with condoms and other written materials on HIV and AIDS that we're able to give the clients. And the laboratory tests are also covered by that.
How many people do you test every year?
Well, last year was our first year in 2012. We didn't get started till March. Our goal to test in 2012 was 125. This year we upped the ante because we were just establishing ourselves in 2012. We went up to 175. We've passed that already. We're at 190, our last count. Last week we hit 190. And we've got 2 months to report yet, so.
And why do you suppose your numbers are growing? Is the word getting out that there's free testing here and you should know?
I hope so. I hope that's why. I've tried to put the word out, and we've had banners on the square, and we've done media outreach. Also, I'm testing at the Tuscarawas County Jail now. So starting at the beginning of this year, every other Thursday, I go to the Tuscarawas County Jail. Inmates have the chance to ask to be tested. It's only voluntary. And if they do desire testing, we go in and test. Wow.
And will you be stopping at any of the college campuses too?
Absolutely. Actually, Kent State University is going to allow us to come in and test for HIV among their students one time this fall, and we hope that becomes an annual event.
Now, we've talked about those two populations, college students, jail inmates, but really AIDS and HIV can touch any population.
Absolutely. In the United States, the statistics are 1.1 million people are living among us with AIDS, and about a fifth of those folks don't know they have it. Everyone needs to know their status. It would just be a well thing to do for yourself and for your family and loved ones.
And as you said, it does occur in Tuscarawas County and our local area.
Absolutely. We've had people who are positive in our county, and we have people living with AIDS, and we have people who have passed away from AIDS since I've been doing this program.
And do you think that people do understand that it's still here? It used to be the topic all the time, and now it's not talked about so much.
Well, when it first surfaced in the 80s, it was a scary thing. We didn't know what it was at first. We didn't know how it was being spread. We didn't have antivirals for that then. So it was very, very scary, and they did do a great campaign on protection and finding out people's status. Since then, it has sort of became less excitable, but people need to know that it is still among us. We haven't eradicated it yet. We need to test, and everybody should know their status.
And when can they come into the New Philadelphia Health Department and get a free HIV test?
We offer testing every day, Monday through Friday. You do not have to have an appointment. Just walk in Monday through Friday, 8 to 4:30. We do close over lunch from 12 to 1.
All right, New Philadelphia Health Department on East High Avenue in New Philadelphia. And come get free HIV testing. The grant's been renewed, so come on in.
Come on in. We'll test you, and we're great people. So.
Great. Vicki Iono, she is the health commissioner for the county. She is the health commissioner for the City Health Department in New Philadelphia. Thank you for being on Medical Minutes here on DMG TV2, Time Warner Cable.
We live in a fast-paced world. Say goodbye to searching books and search engines for all the answers. Now there's iTowns. From finding a place to dine or locating your family doctor, you can also check out the high school game of the week from TV2 Sports. Get your answer with just one click. iTowns has it all.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more. Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
Welcome to DMG TV2's Medical Minutes here on Time Warner Cable. I'm Jennifer Clark, and this segment we're joined by Norm Mast. He is the President and Executive Director for Community Hospice. And Norm, first, welcome to the show, and tell me all about hospice. You hear about it, and everybody wants to donate, wants to volunteer. What is hospice? What do you do?
What do I do? Wow, that's a good
That's
question.
a lot,
Yeah,
isn't
it is a lot. Well, our organization's been around for 26 years. 27 years, and it was really started by a group of individuals who looked at healthcare in Tuscarawas County and saw that there was a real need for end-of-life care. Hospice was something that was starting to become more popular, not more popular, but just was starting to be utilized more. And there was a group of 3 women who kind of said, this is something we need and a service that's really needed.
And when you say end-of-life care, you mean things that you want to do not only for your health care, for whatever disease or problems you're having, but to make it quality care,
yes.
Right?
And it's about providing a quality of life at end of life. That's what we do. We have a new mission statement, and the new mission statement says that our mission is to honor life by providing peace, hope, and compassion to those we serve. And that's really what we're there for. And it's not just the person themselves or the patient that we have, but it's the entire family. We really focus on the family as a whole unit. And it is about end of life. The criteria for coming into hospice is that you just have to have some life-limiting illness that's less than 6 months, that's expected to have less than 6 months of life.
But often people call hospice when there's a couple of days.
Yeah, and that's
they don't need to wait that long.
That is the misconception. They think that we don't do anything until the waning hours or the last hours when we really need help. And so it's really that's the part of the education we're trying to get out to people is that hospice doesn't mean the end, and it doesn't mean that just because you sign up for hospice you're going to pass tomorrow. It's really about allowing us to get in there, manage the disease as best as we can so that you can have a good quality of life.
And there's so many programs. There's music therapy, there's massage therapy, there's all kinds of things that go on to not only, like you said, help patients, but the whole family can take part.
Yes, they can. Yes, music therapy, art therapy, massage therapy, those are all things that we're not required to do as a hospice, but it's something we believe in and we feel as though it adds a quality of life. We have a wonderful bereavement program that supports families before the death and after the death, and even the patient, if there's things that they're going through. We have certified grief counselors that can come in and do individual counseling with patients and families. We have a lot of great programs that we have available for them.
And community hospice in Tuscarawas, Carroll, and Stark County, and a little into Holmes County, you're kind of spreading out here. You've grown so much that you're now in the hospice house. What's the house?
The house. The hospice house was a twinkle in somebody's eye 10 years ago, was an idea that was generated for really, they saw a need for patients who had symptoms out of control, things that were happening at home that maybe the average layperson, the mom or dad or the husband or wife just really couldn't handle. And so what it does is it allows people to bring or to have their loved one come into our facility, and we take care of them and get the symptoms under control. And the goal is not to really keep them there for an extended amount of time. It's really about getting them back to where they can get back to where they want to be, which is usually at home.
And so why not just go to a hospital?
That's a good question.
The hospice house has so many special things that a hospital
it's
doesn't have.
It's a home-like setting, but also when you're on a hospice, on hospice, the goal is to keep you out of the hospital. That's what we're paid for. And so if you're going to go back into the hospital, you usually have to sign off of hospice. That's what happens. So the goal is to not allow, to prevent that from happening. We have nurses that go out on a weekly, sometimes daily basis that can monitor how your symptoms are doing so that you don't have to go back into the hospital. That's what we're really there for. And at that point, most people, you know, they don't want to go back in, and they don't want to be bothered with having to leave their home setting. But the hospice house is so much, to me, and everybody says, so much like a home setting. It's really...
it feels like a home when you walk in. And every room is, there are special codes that you have to meet. The doors have to be so wide. You have to have fresh oxygen. And, but at the same time, it does look like somebody's house. Yeah. And there's warm soup, and there's all kinds of things. There's a kitchen.
This time of the year, we now, we have Christmas trees, we have decorations up, we have all that stuff going on. And that's all part of making it feel like home. Because if I'm not in my home, I don't really want to be in a sterile environment that looks so, I want to be reminded of the holiday season. I want to be reminded of those things. If it's going to be my last, that's what I want.
And community hospice for the holidays is going to have the 12 days of Christmas?
Yes, we're doing what's called the 12 Days of Christmas, which start on December 9th and run through the 20th. And we have great events going on. Every day we're going to have carolers in our hospice house, as well as cookies. We have 3 or 4, I know this is hard to believe, but Santas that are trained volunteers that have gone through our training that are coming in several times during those 12 days into our children's room so that families can bring their children in to visit with Santa. We have a live nativity that's going to be on our front porch that one of the local churches has decided they want to do for us. And so it's really, it's a celebration of life during those 12 days. And we want to make, if you're in our facility, we want to make sure that they get to experience that celebration as well.
We've talked about all this growth with our local hospice. What's next?
Oh, I'm sorry, I can't tell you that.
Oh,
no, I'm kidding. No. You know, the growth is, we're not growing because we want to, because I want to be the biggest hospice around. That's really not the focus of what we're doing. The growth is because of the need that's out there. We want to reach individuals that maybe don't have access to hospice, but the growth is so that I want to make sure that this organization is around in 10 years. There's so much going on in healthcare that's so unknown that I have to make sure that we're sustainable, especially with a new hospice facility that we're still trying to raise money to pay that facility off. And so that's the challenge, and that's really what I'm looking at over the next year is where do we go next, and what do we do with providing those services, and what alliances do we form, what is it that can make us a stronger organization.
And so comforting to the community to have a hospice house and to have all of that care for end of life.
It is, and the hospice house is actually a very unique thing for a rural community. And that's where the community and the volunteers and the board and the employees, they've all played a part in getting this facility up and running. And it's not something that you see in a rural area. And we are very privileged to be able to have that in our area.
Very good. Norm Mast, he's the President and Executive Director of Community Hospice here on Medical Minutes on DMG TV2.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
Welcome back to Medical Minutes here on DMG TV2 on your Time Warner cable. I'm Jennifer Clark, and on this segment we have Dr. Bill Swoger. He is with Union Internal Medicine Specialties, and he is going to tell us all about flu. But it's not what you think. When you think flu, a lot of people have the flu, but it's really a flu-like symptoms that they have. What is actual influenza?
Influenza, the actual flu that we get vaccinated for, is a viral infection. It's a systemic, meaning whole body viral infection. The flu is also a viral infection, but it causes different symptoms and problems. The common flu, the slang term, is gastroenteritis or vomiting, diarrhea, nausea.
All those fun things.
Yes, yes.
And does it last very long?
No, 24, 48 hours, 1 to 2 days, yeah. Influenza is a potential bug that causes a pneumonia.
So it's a little more serious.
Right. And worldwide, it can be very dangerous. Every 3 times a century, it becomes a pandemic where a lot of people get sick and actually die. Thankfully, the mortality rates are reducing over time, mostly because of vaccinations. Influenza happens all over the world at different times.
But
here,
not just in the winter?
No, nope. Here in the northern hemisphere, it happens commonly between November and April. There's a little splay in the season because of the weather. If the winter doesn't hit until later, influenza season usually is a little behind.
But the weather, no matter how cold it is outside, that doesn't cause the flu.
It does not. The common theory is that people are more congregated in buildings in front of each other, coughing, sharing
We're not
viruses.
outside, we're all inside.
Yes, sharing viruses at events, sporting events, you name it. Going to the doctors. It's a common place to have the fear of influenza. Yes.
What are some of those symptoms of influenza, the more serious?
Okay. Influenza, the actual viral infection that can cause a life-threatening pneumonia, high fever, not just a low-grade fever, 103, 104, shaking chills, rigors, cough, and severe muscle aches. Myalgias are the severe muscle aches. Not just a little achy, it's
a lot achy, like you
spasm.
can't lift your head off the pillow.
Yeah, yeah.
And that lasts longer than just a day or two?
Usually 1 to 2 weeks of symptoms altogether, but usually the bad stuff is early on, first 3-4 days.
What can you do for it? You just stay home?
Good idea to stay home, at least initially, so that you don't infect others. You try to push fluids and, Tylenol for fever and
things. I don't feel good. I'm not drinking or eating anything.
Right, right. And that's when older individuals and very young individuals, 2 years and less, mostly 6 months and less are high risk because you can get dehydration and get a life-threatening pneumonia if you don't keep up with it. There are treatments, but the treatments do not actually get rid of the disease, unfortunately.
You just treat the symptoms until your body can get rid of it.
Correct. Reduces the symptoms and the duration of the illness by 4 or 5 days at best. That's things like Tamiflu, Relenza are the 2 common treatments.
Can you get those over the counter?
Nope, has to be a prescription.
So they come into your office
Have
and
to
say,
see the doctor.
I really feel sick. I need something to make me feel better. I don't want to miss a day of work. Kids, they don't want to miss a day of school, or
Sure.
But when you're sick, you should stay home, right?
Yeah, if you have a flu, meaning the 24-hour type, yes, you can get away with that. But influenza, it's a little more severe disease.
And you can be hospitalized?
It can be life-threatening. It can kill people. Worldwide, thankfully, the mortality rate is coming down, and I think it's because of vaccinations. But up to 500,000 people die a year when we have pandemics, meaning, the last one was in 2009. Thankfully, not that high of a mortality rate. The swine flu, H1N1, that was an influenza A virus.
That's kind of a panic situation.
Killed a lot of people.
Should we panic?
No, no. the best advice is to learn about it, communicate with your doctor, your family. Everyone should get vaccinated.
And when we're getting ready for flu season, you hear a lot about that. Go get your flu shot. What's in a flu shot?
The flu shot is your way to build antibodies to the virus. It's protein, it's a formulation of the viral particles, not a live virus.
Yeah,
it's the viral particles.
I don't get the flu by getting the flu shot.
To help you induce the antibodies you need to protect against influenza.
So your body can fight it off.
Right. And that's changed. You know, we used to have just one influenza vaccination. It was what we call a trivalent vaccination, made up of 2 strains of influenza A and 1 strain of influenza B from the prior few years, from the most virulent strains, meaning the one that was hospitalizing or killing a lot of people. And that's the following year, that's what the vaccination is.
Even though it's for
directed
last
at.
year's strain, it's still effective.
It is effective. It is not totally preventative, but it's a pretty good preventative maneuver to help either reduce the severity of the influenza or to not get it at all.
And everyone should get a flu shot. It doesn't matter if you're high
Everyone.
risk or elderly or young, or
Correct.
everyone should just get it.
Yeah, especially the elderly, especially very young, 6 months less. Pregnant women should definitely get it because of the more severe illness if you're pregnant and develop that influenza and pneumonia. Anyone with a heart or lung disease or diabetes or cancer, you know, anything that would suppress your immune system, you should be vaccinated.
And when is the best time to get the flu shot?
I tell patients mostly late October, early November.
So is it too late now?
No, no. There's 2 peaks in incidence of influenza season. If you get it too early, the thought is that your antibodies are starting to wane and you're not having the immunity when we get the second peak of influenza, usually January, February. If the season's a little late, March or April, theoretically you might not be protected.
So it doesn't last very long.
Correct.
All right, so you just need to practice good hygiene, wash your hands, cover your cough, stay home when you're sick.
Yes.
And if you have any questions, call your doctor, right?
Right. Now the way you can help prevent acquiring influenza, it is killed by soap. Hand washing is very effective. You can get the virus by spread through the air, what we call droplet spread, coughing, sneezing, distributing through the air in these droplets. Coughing, you know, protecting your cough, covering your cough, you hear that commonly. That helps reduce everybody else's risk of influenza if you have it. If you don't have it and you're trying to prevent it, hand washing, you know, reasonable protection, and identifying individuals who are coughing and sneezing and having high fever, you kind of avoid them. Masks are somewhat protected, but a societal thing. You can't walk around with a mask every day, you know, unless there's a really bad pandemic. And that's, you know, if you see pictures in other countries, they wear the masks, you know. So the other way is direct contact. You can, if someone coughs or sneezes on a surface,
right, as soon as you touch it, yeah.
You put it
You
to your
got
mouth,
it.
you can get it. So good hand washing and using common sense, avoiding really congregated areas with a lot of people coughing and sneezing.
Great, all really good information about the flu. Thank you to our guest, Dr. Bill Swoger from Union Internal Medicine Specialties in Dover. And for Medical Minutes and TV2, I'm Jennifer Clark.